Hi, I'm Dr. Mike Milligan. I'm here with Dr. Lisa Marie Samaha of Newport News, Virginia, founder of the Perio Passion Seminars. Lisa, thank you so much for being with us.
Thanks, Mike. My pleasure.
With the oral systemic health boom now, dentists able to help so significantly their patients through treating their periodontal disease, their mouth bacteria, preventing so many problems throughout the body. Lisa Marie has developed the best program out there to help us control periodontal disease and prevent it.
Thank you.
Period. And so we're going to talk a little bit about that and then tell you where you can get more in touch with that. It is so important for the health of our patients, and we owe a lot to Lisa Marie, all the research she's done to put this all together and to teach us. Lisa, thank you so much for being with us.
Thank you, Mike.
Tell us a little bit about the Perio Passion Seminars, and then we'll talk about how we get a hold of you.
Well, as you may know, I have been doing this for about 31 years. I've had the good fortune of being raised by a periodontist dad who had a great vision and mindset for the whole oral systemic connection, obviously before it was ever a term. And so as a little child, I remember growing up with that philosophy. And so when I started my own practice, even though I had never been introduced to that concept in dental school, as none of us were, it was just not even discussed, I just always had it in my head. And so, I followed suit. And when I first started my practice as a young graduate, I had only one vision, and then that was to create a practice that really treated the whole body.
Right.
And so I feel like the mission for Perio Arts Institute, i.e. the Perio Passion Dental Seminars, is clearly to help transform the way dental practices help their patients heal.
Right.
And so it just created this great vision for putting in our hands the concept of total body wellness,
right,
and that we as dental practitioners can work with our patients on so many levels and start peeling the layers of health down to the very basics of cellular integrity.
Right.
And then use that as our foundation to help support the gum tissue, heal the gut. We talk about
it's a very comprehensive program that you have. It deals with nutrition. Tell us some of the things that it deals with. Certainly periodontal therapy, probably some counseling with the patient on a variety
lifestyle
of things.
And so forth. Yes.
Okay.
Yes. So we want to help support the body from the inside out. It first starts with gut, and then it moves into, supporting the rest of the body on a cellular level.
You're a perfectionist and a communicator with your patients, and you really care. I remember we were at an aesthetics meeting a few years ago. Lisa Marie got the restorative awards for at the aesthetics meeting, and yet she's the
walk away with a lot of
and
cosmetics.
You walked away with a lot of awards. Many different practitioners at the aesthetics meeting showing what they did. Lisa won the restorative. So she's detailed. She looks at the entire picture. She brings it all together, makes it simple, makes it implementable, if that's a word, in your practice. And it's a 2-day seminar that you have now.
And we absolutely start with an overview of the oral systemic connection. So I have it broken down the first morning, where there's a general introduction into oral systemics, and then there's a breakdown of every organ system and the basis of research that we have, current day research that we have that supports the entire protocol that we want to do. So we go cardio, endocrine, pregnancy, Alzheimer's, etc. So we go into all of that, and then once everybody has a good basic feel for the reasons why we want to learn for the next day and a half, then we have,
Then we go to how.
yeah, then we go to how
Absolutely.
to and the protocol. And at the end of that morning of the oral systemic research, we get into nutrition, and very heavily. So there's a heavy segment on that, gut health, and then through how do we use targeted nutritional supplementation to help support our periodontal patients, because these patients are sick, whether they're symptomatic, systemically symptomatic or not, they're sick on a microvascular level. And so we want to really get them supported so that then we can move on with more success in the clinical arena. And
If
kind
they're
of
nutritionally healthy, you're going to have more success with any therapy
absolutely.
that you do.
As
Without a doubt. Well,
yes,
I've done studies on
yes, yes, and we want the terrain, the sulcular epithelium, to be sealed. We want it to be a beautiful wall that helps prevent the penetration of that virulent bacteria through and into the bloodstream. So that's a really important part of it, and just actually, but just one small part, because as you know, we have an entire list of things that are part of our protocol, including DNA testing and blood testing, some urine, urine testing, blood testing, salivary testing, to test levels of systemic health and disease. So from hormones to, just about anything else you can think of, because it's all related to how well the periodontal tissues behave. And for instance, in my own experience, whoa,
that would be oral systemic.
What a concept.
Okay, there we go.
So, even in my own personal experience, as I've shared with others, when I went through menopause, which was really very easy for me. I have never used any medications for anything, and in my life. And so I went through this process without even noticing it, except for one thing. Mm-hmm. I had never in my life had a problem with my gums until I was at the end of menopause, and all of a sudden, I'm brushing and I'm seeing blood in the sink, and
that
I'm
happened to me too when I went through menopause.
Oh my God, menopause. Okay.
So that did surprise you.
Yeah, it was shocking to me. It was freaking me out. Here I am, Perio passion woman, and so I have this great sympathy and empathy for all the hormonal changes that affect us throughout life, and it's one of the reasons we do look at hormone status and all of that. And there's so many ways that we can help work around. If we get the gut healthy, then insulin resistance goes way down. Blood sugar issues. Right. We're just, everything is starting to balance itself.
So you look at the total body systems. You have several diagnostic aids that you're looking at. You talk about several different therapeutic aids, and then, of course, the home care and what the patient needs to do. You're looking at 2 days. You have the, who comes to the meeting?
Well, general dentists who obviously have the same inclination towards this concept, as well as periodontists. I've had an orthodontist actually come.
And they bring how many staff?
Well, typically I ask them to bring at least one hygienist, one clinical assistant who's going to be really excited about this, and if they don't have one on their team, they need to find somebody, and then an admin team member. So I really, at a minimum, 4 people from the practice. I don't want a doctor to send his hygienist or team without him or her, and I don't want to have a hygienist there without the doctor and other team members, because it's just not going to fly. It's a very multifaceted protocol for a very multifaceted condition. And we have got to have an entire team understanding, first of all, why are we doing it, and then how do we do this protocol. And many entire
teams come as well. I mean, you're not limited to that, but she would like to have at least that, so you really get the information and get this implemented. Many bring their entire team, all the hygienists, all the front desk.
Yes, absolutely. And we're looking now at doing some seminars where there's a gathering throughout the country of, like 60, 70 plus practices where we're able to, work with them as a nice group, like they're regional
Right.
groups of people. And
I noticed that you're moving, she's got meetings around the country, in Nashville, San Diego, Virginia.
we have a fundamentals course coming up November 15th and 16th of 2013.
Right.
That's the last one in Virginia. That's the last one for this year. And then in April and October of next year, we're going to be in Nashville for a fundamentals course and an advanced course.
Right.
And then we'll be in San Diego at a beautiful resort in November of next year. So.
And for the schedule beyond that, how do we, and more information, and to get registered, because you really need to do this, how do we get in touch with you? Do you have a website?
PerioPassionDentalSeminars.com.
Okay.
And that's probably the best way. We have a toll-free number, and I can't think of it right now.
Well,
But
it's on the website. Okay.
that's in registrations on the website, and there's
Okay.
a little video of a couple of videos and things, and lots of doctor testimonials and hygienist testimonials on there that are always good to see.
Oh, absolutely.
Yeah.
Any last thing you'd like to say before we close, Lisa?
Just what an exciting era of dentistry this is, and how absolutely exciting it is to be a founding member of the American Academy for Oral Systemic Health. What an absolutely first-class conference we're having this weekend, and how I encourage everyone without question to become a member and join this movement, because it is just blasting.
Right. And it's so
blasting
rewarding
forth.
to help your patients.
Yeah, yeah. And it's not for everyone, of course. We're going to have patients who are geared, who are patients who are suited for our practice. Like, for instance, in my practice, we really heavily attract people who are health conscious,
Right.
and who want to become health conscious, and a majority of our practice are actually lower socioeconomic individuals.
Interesting.
And
They just have that health. They wanna
yes,
be healthy.
and so we're really
They
a
get it.
middle class practice
Yeah.
in a middle class town. And yet we do extraordinary levels of high value, big value cases.
Right.
So the Perio as a foundation, and then reconstructive and so forth, on people that you never would imagine would have 2 dimes or would even care to invest
Right.
in this kind of care, but they certainly are getting it more and more all the time.
They do. Get in touch.
Oh, and one last thing. We do have a marketing package
Oh.
that's developed that is going to be really awesome, because it's a way that any practice can market through print media, radio, and television.
Wonderful. Glad you
As an
mentioned
oral
that.
systemic practice, and it is geared towards them as alumni, or as Perio Arts Institute affiliate, or Perio Arts Institute practices.
Great.
So.
Well, get in touch with Lisa, help your patients, and help your practice. Lisa, thank you so much for all you do
Mike.
and for being with us.
Thank you so much.